Hi, and welcome to Meet the OBGYNs. I'm your host, Corey Jensen, and I'm so excited to be here with you and introduce you to some amazing, highly skilled Essentia Health OBGYN team. These providers are so great, they're knowledgeable, and I'm hoping that you get some questions answered tonight that maybe you didn't even know that you had. So we're going to get into this evening and have a lot of fun in our virtual event. And just know this, everything you need is right here at Essentia Health. All right, to kick off, meet the OBGYNs here at Essentia Health. I've got Dr. Homan. Now, you are going to be my girl that I go to about all of the exciting changes that the OB clinic has made. Now, first and foremost, just floor number 6 is popping. You guys have made this place so comfortable, so gorgeous. You've emulated what all of the providers already give their patients in a physical form. Can you tell me a little bit more about the changes that have been happening here on this floor?
Absolutely. We're really excited about a lot of our renovations. We have done a remodel not only of our clinic lobby area, but also in our birthing center. We have 15 brand new labor, delivery, and postpartum rooms for our patients that we're really excited about. They have these same floor-to-ceiling windows, some wonderful amenities that we've added, including the jacuzzi tubs. We have the in-room refrigerators for patients to have, their own amenities. So some really spectacular fireplace on the wall. I almost forgot about one of our favorite features is the fireplace. So yeah, we really are trying our best to make it feel like home. We want this to be a wonderful experience and an enjoying time when you have your baby, and whatever we can do to make that more like home is what we want.
I love it. I love this place. Have always been an Essentia girl, a fangirl, if you will. So I want to find out a little bit more about you, Dr. Homan. So will you give me some insight? Like, what's one thing that you love your patients to walk away knowing if they are receiving care from you?
I think one thing that is really resonating with all of us right now is just during COVID and a lot of fears people have, especially with COVID and infection and pregnancy, that we're still here for our patients. We still want to connect. We want you to get the health care that you need, whether that's coming into the clinic for your appointments or virtual visits. Essentia has made a big commitment to virtual visits, and we have that same commitment as well.
Well, you're doing a great job, all of the providers here. I love the team approach that Essentia Health takes as a whole, as a world-class medical facility, but something special is going on here in the OB clinic. So thank you so much for your time.
Thank you, Corey.
All right, it's time now to introduce you to 3 great providers here at Essentia Health in the OB department, and we're going to talk fertility as well. Thank you guys so much for joining me. I've got Dr. Jan Bexel-Gierke, Dr. Pandolfo, and Dr. Homan here. Thank you, ladies, so much for being here and being a part of the wonderful Essentia team, which I have a question about that. But first, I want to ask you guys some direct questions about kind of your specialties. Like, Dr. Pandolfo, you have specialized now in infertility, and if Essentia Health has some patients that have questions about it, or if they are concerned about fertility, how can you help lead them?
We've been working a lot over the last couple of months to really grow our fertility program. We're now at the point where we have a physician and nurse practitioner team where we can do the full evaluation, diagnosis, and treatment plan for your infertility needs, including labs, imaging, IUI, kind of everything short of in vitro fertilization we're able to take care of here.
One of the great things about this clinic is that you guys continuously expand your services. So it's so exciting to see where fertility is going and continues to grow here at Essentia Health. Dr. Homan, I want to ask you a question about what your patients often ask you. What is like that number one question that patients are coming at you right now about?
Recently, I feel like it's whether I want to be pregnant or am pregnant or breastfeeding. Is it okay to get the COVID vaccine? It's been a really big question. And so as a department, we have been following the same ACOG standard guidelines as well as the Society of Maternal Fetal Medicine, which have been supportive of getting the vaccine in all of those situations. We know that the risks of the virus are significant when you're pregnant, and as best as we know, the risks of the vaccine are minimal or nominal, and so there's truly benefit to be vaccinated and not get COVID in any of those situations.
Feels so good just to have a provider share that information with you too, especially when you're pregnant. And I mean, it doesn't matter. You're always going to be anxious if you're expecting, but it feels like because of the pandemic we're in, that is one of the #1 concerns. The anxiety is so high. So Dr. Bexel-Gerke, I have that question for you. Is the mental health of your patients right now, are you seeing an uptick in anxiety, depression, that just scared nature that it feels like the world is in right now?
Yes, and I mean all age groups are feeling it, but I think especially there's so many different transitions in women's lives, and especially when you're pregnant and especially postpartum, there's been a big push to recognize postpartum depression, and so we have implemented postpartum. Patients come in 2 weeks to make sure they're not having depression symptoms. We encourage them to call. So there's a big push because it really, especially in this time with COVID, there's just a big uptick. You're correct.
And I have to say the services now with those added virtual visits too can help hopefully take care of some of those anxious feelings and the questions that women might have.
Yeah, and they can be on the video, and we can safely talk, and I think they feel more comfortable, and then we can, whatever they need to have done, whether it's counseling and or medication, we can get this going for them.
I will say though, as an Essentia fangirl, as I call myself, one thing that I've always credited you guys for is your team approach. Does anybody want to speak to that and how you feel about Essentia handling a team approach with this facility?
I would trust any of my partners taking care of any of my patients. We get attached to our patients, and you want to be there for their delivery and for their big moments, but every single one of my partners is capable and more than willing to take over to take care of my people.
I love that. Thank you ladies so much for coming in. We really appreciate it.
It was like you can't even describe it. I always tell people who don't have kids, it's like your heart running outside of your body. It's just incredible. Like, you made this little human and you do everything you can to protect them.
All right, it's time now for our gynecology panel here. We've got some great specialists and experts on the panel. Welcome, you guys. Thank you so much for sitting down with me tonight.
Thank you very much.
Thank you.
I'm going to kind of do a little round the horn and introduce everybody and put you on the spot, ask you some good questions here. So we've got Dr. John Ballantona. We've got Denise Schumacher-Rondo. Doctor, obviously, and Dr. Heller as well. Thank you guys so much for being our GYN portion of the panels. Dr. Ballantona, can you tell me a little bit about Essentia Health's options for people that are concerned or a patient or want to be a patient?
Certainly. Here at Essentia, we have several options for our patients for whatever their gynecologic issue might entail. All the way from a variety of medical interventions that we can offer, all the way into surgical options that might be appropriate for that patient. The beauty is, with the group we have now, we have several people who have, I want to say, specialties or have special interests in certain techniques. Mm-hmm. So we are able to offer our patients, if it's not the particular provider they're set up with someone else in our department who can possibly provide them the service that they need.
I'm glad you brought up some specialty services, because the specialty service that is like not a red flag, but a very interesting flag for me is robotics. and how that is even possible to be able to use robotic surgery in GYN. And Dr. Heller, you can probably speak a little bit to that.
Yes, so our surgical specialty offers anything from minimally invasive to open procedures, and one of the tools that we have for the minimally invasive procedures are robotics. We have a state-of-the-art robot that assists us in surgery. Us as surgeons continue to do the surgery and manage the robot, but it's much more minimally invasive compared to standard open procedures for such things such as hysterectomies. We have the XI model, which is the top of the line. So it offers a lot of options for patients.
I mean, I'll just go ahead and say it as a patient here at Essentia. I love the idea of then being able to heal faster. My scar is going to be much smaller, and these are kind of those, you know, real life, maybe a little vanity every once in a while, but hey, you know what? This is something that a world-class facility is able to offer, and that's what you guys do here at Essentia Health. Dr. Schumacher-Rondo, you would be able to speak to what patients need to know.
So I think one of the big things about Essentia Health that at least I'm very impressed with is our access. I think it's a not unusual understanding in not just this community, but many communities, that if you want a specialty care consult, and for us that would be GYN, things that primary care professionals might send people to us, that you might have to wait 4 weeks, 6 weeks, 8 weeks, and that's kind of considered normal. At Essentia, that's not normal. We actually have same-day access, and we can certainly get patients in within a week. And oftentimes, by the time you might see specialists outside of Essentia, you could have been seen and actually had your problem fixed and be back to a normal life and enjoying things. So I think that's really important for people to know, that you don't need to wait that long. We can get you in.
When you want to get great care, but then also you want to get out of pain. Of course, patients want to know, what is my fastest way to make that happen? Now, you guys also do something pretty fascinating here at Essentia Health. I know all of you are kind of on the road a little bit. Now, you would be able to tell me a little bit about that outreach that you have.
Yes, we have an opportunity to bring our act on the road, so to speak. Several of us go to outreach clinics, for example, in Jamestown and Valley City. We have patients that, or we have appointments that we can set up there, as well as Lisbon and Wahpeton.
All right. Now, final question before I let you guys out of here, and that is, do you need a recommendation? Do you need a provider to say or lead you into the GYN department? Or can somebody just call and say, here is my issue?
Nope, you can just call in and say, here's my issue. I think I need to see a gynecologist, and we'll be happy to see you, and quickly.
I like that. Thank you guys so much for your time.
Thank you, Corey.
Thank you.
I make a point of grabbing Mom's hand and being like, I got you. We're gonna be fine. I'm gonna tell you what I'm worried about and what the options are gonna be to make sure that both you and the baby turn out okay. I wish everybody could see the look on Mom's faces when you hand them their new baby. It's like you just have this pause and you're like, here you go. Like, this is the rest of your life.
All right, our final panel tonight is our high-risk OB panel. And so I want to introduce you tonight to Dr. Lynn, Dr. Sander, and Dr. Strang. Thank you guys so much for joining us here tonight. We really do appreciate it. Your work is so important, and I want to learn more about the birth work that you do here at Essentia Health. So first I'm going to ask Dr. Sander about preconception, because I think a lot of people still think, oh, I've got to be pregnant before I make my appointment to be seen.
Absolutely. We are happy to see you even while you are thinking about getting pregnant. We want to make sure that you feel comfortable, know us in our department, and make sure that your chronic conditions are well managed even before getting pregnant. We'll be reviewing your medication list, making sure that your medications are ones that you can continue on and are safe in pregnancy.
I like that. And I love the idea of just being able to meet the providers and get to know them a little bit, because that has been one of the things that I always talk to people about, is how much I just love the providers that I see here and the team approach that you guys do. You're great communicators with everybody and all the departments work really well together. You need to in order to have a successful facility like Essentia Health is able to do. Now, I have another question here, and I'm going to ask Dr. Strain this one. What's that one thing that you want your patients to know?
I think it's important that our patients know that we have access to maternal fetal medicine at all times, so we can consult with someone who's got that higher training if we need their help. We also have access to the fetal monitoring that we would need to do for certain high-risk pregnancies here. And so it's a very safe place to be, even if you are a high-risk pregnancy, to see a general OBGYN, because we do have that backup for the maternal fetal medicine team if we need it.
Yeah, I like that a lot. And Dr. Lynn, I've got a fun fact. You probably wouldn't recognize me behind my my mask.
Probably
but
not.
I was in on a delivery in which you were the delivering doctor. And you're a showman.
I did okay?
You did great.
Okay.
It was a wonderful delivery that I had the pleasure of being with my best friend who was delivering her baby.
Very cool.
So, and I am his godmother, so I got to say, very special. We go way back.
Yes.
You
How long
didn't
ago was
even know
that?
it.
How long ago was that?
Within the last year.
Okay.
So I do have a question for you, though, in regards to a question that you get asked a lot about, because you have been doing this for a long time and you've got a great career in the field of OB. So what is that question that you get asked a lot?
Well, I don't know if there's one. There's lots of common questions, but some women worry they're too old to get pregnant, and certainly historically, people gotten pregnant at a very young age, and they still are. But more and more as we get older, a lot of people are delaying childbearing, for career reasons or other reasons, and they start to wonder, am I too old to get pregnant? Well, and you can be too old to get pregnant, but for most women, getting pregnant as they get older is not an issue. There's some issues, but they're manageable. First and foremost is just maintaining your health. Whether you're younger or middle-aged, the healthier you are, the better you're going to be in every way. And that includes pregnancy. And there are more complications, or I should say potential complications as you get older, things like gestational diabetes, gestational hypertension, preeclampsia. But those are things we can manage and deal with and even try to prevent where we can. Chromosomal anomalies in the fetus are increased with age. That's something you can't control. No matter how healthy you are, you cannot change that. There's testing available for that for those that want it, and not everybody wants it. And we can handle pretty much all the high-risk pregnancy situations that might arise.
I know that because of the team approach that you have, especially with the way you guys communicate. NICU, you guys, let me just say, it is all about that NICU. Essentia went through a huge remodel, and can anybody talk to me a little bit about those changes that you've made to that department?
Yeah, the 4th floor has been remodeled. There is now a beautiful 14-bed NICU unit where the parents can stay close to their child even after they are discharged. We have board-certified neonatologists. We are a level 3 NICU, and we are the certified baby-friendly hospital in the region.
I like that, baby-friendly. Isn't that what we want? It for certainly is. Thank you guys so much for your time tonight. We really do appreciate it.
Oh, great. Thank you.
Thank you so much for joining us here tonight. Just remember, if it's a question that you may have about some topics we covered tonight, or a question that you have on your own, be sure to consult your provider, and you can call anytime at Essentia Health. Have a good night.